beginning. My name is Evelyn Mantilla. I will be your moderator for today. In today's webinar, I am happy to introduce you to Gary Dorsey. Gary is the Director of Product Development here at Access Health Connecticut. And you can sit right here, Gary. Wonderful. Gary, welcome. And I know that you have a few words for everyone.
Thank you, Evelyn. First, I want to say thank you for participating in our first in a series of monthly webinars geared towards informing our brokers on a series of topics, including best practices, services, and updates here at Access Health. If there are other topics you would be interested in hearing, please let us know through our broker services line. Today's webinar is all you need to know about the 2019 plans. Ann Lopes and Ellen Kelleher will present what's new, what's gone, and what you need to do to best help your clients. Ellen, Ann?
Thank you, Gary.
Want to sit here, Ann?
Hi, my name is Ann Lopes. I'm on the plan management team here at Access Health CT. And like any year, many consumers will see changes in their health insurance coverage for 2019. Most consumers participating with Access Health CT for 2018 will be automatically assigned to a plan designated by their current insurance company for 2019. We intend to review each of the topics listed here during this presentation today. The objective of today's webinar is to ensure that brokers are aware of what plans will be available through Access Health CT for 2019 in the individual market and are aware of major changes impacting consumer plan selection. Because of these potential changes, Access Health CT is implementing a communications campaign emphasizing the need to shop, compare, and enroll. And with that, I will turn this over to my colleague, Ellen Kelleher.
Hi, Ellen. Welcome.
Thank you very much, Evelyn. Good afternoon, everyone. Thank you so much for joining. There's a lot of good interest in this topic, and we're very pleased to provide you with the detail. One of the things that you'll note is that we will be, on some of these slides, we may be scrolling through very quickly, but rest assured that you will be receiving this information afterward that you can really digest through at your leisure. There's a lot of great information here. So, and you may even be alarmed at some of this, the information that is on the slide. Don't worry, you'll get to look at it afterward. So with that, what I'd like to do is turn it to the next slide, please. So we will be talking about the qualified health plans that we will be offering in plan year 2019 in the individual marketplace on Access Health CT. Next slide, please. Okay, so this graph is just giving you a high-level summary of the plans by both Anthem and Connecticut Benefits, Inc., known as CBI, that will be offered in plan year 2019. If you look at the chart, the second and third columns show the required number and maximum number of plans a single carrier could submit. The last three columns on the right side of this chart show how many plans will actually be offered by each carrier, along with the total number of plans combined, as you see here, totaling 17. For plan year 2019, Access Health now requires that carriers submit 2 standardized plans at the silver metal level and permits only 1 non-standard plan offering. This is somewhat different than what was offered, what was allowed in 2018, wherein 1 standardized plan was required with up to 3 non-standard plans permitted. As a reminder, standard plans are those where Access Health CT prescribes the cost sharing for certain covered services in the plan, and carriers are required to submit those standard plans in order to be able to offer any other plans through Access Health CT. Non-standard plans are simply those plans that carriers design and may be more tailored to the uniqueness of the carrier's product line, providing additional consumer choices. And once again, there will be 17 plans available through Access Health CT for plan year 2019, with 2 of those plans being catastrophic plans that are generally available only to enrollees under age 30. Next slide, please. So again, this chart is just a different view of the plan count for 2019. This one focuses, though, on the product offerings. Anthem will submit both HMO, which are the Health Maintenance Organization plans, style plan, and Preferred Provider Organization product type of plan, while CBI submits point of service plans. It's interesting and important to note that in one of the CBI plans for 2019, the Bronze Passage Plan, a primary care provider, or PCP, must be selected as part of the enrollment process. If a PCP is not selected, the enrollment will not be complete. Next slide, please. This next slide and these next few slides will be talking about what's essentially changing on the qualified health plans for plan year 2019. Some 2018 plans have been renewed by the insurance company, but some have not. For some renewing plans, the cost sharing, meaning the plan deductibles, copays, and coinsurance, etc., were modified by the insurance company as part of the annual rate and form filing process regulated by the Connecticut Insurance Department. For plans that are terminating, the new plan design to replace it may be quite different from the previous plan. Some consumers may benefit by this through lower premium costs and/or plan design changes that could potentially result in lower out-of-pocket costs. Some consumers, however, may find that the new plan has a different network of providers than what was included in their 2018 plan. There will also be new plan choices for consumers for 2019. Some of these plans may be more suitable to consumers than the plan that was selected for 2018. At the silver medal level, lower cost options have been introduced in all counties within Connecticut. Consumers who choose a specific silver plan in the past may find that it is a much more expensive plan option relative to the new silver offerings available for 2019. Next slide. In this particular slide, and the next two, provide a listing of each of the 2018 and 2019 plans available through Access Health CT with an indicator of whether the plan will be renewed, terminated, or if it will be new for 2019. The plans on this slide are the catastrophic and bronze plans offered by Anthem. For existing enrollees eligible for auto-enrollment, this also shows which plan an enrollee may be mapped to for 2019 if the plan selected for 2018 will no longer be available in 2019. Additionally, in the second to last column, we've also provided information on the level of plan changes for 2018. These are either no change, minimal changes, or significant changes, or new plan in the case of one that did not exist for 2018. For many of the plans that are not going to be available in 2019, there will be significant plan changes when comparing the 2018 benefit design to 2019. Examples of those are the 3 bronze HMO plans for Anthem being terminated that are listed on this slide. These will all be mapped to the new Anthem Bronze HMO Pathway X Enhanced Tiered Plan. In the last column, the rate change for an unsubsidized individual is displayed for any plan that is renewing or being mapped to a different plan for plan year 2019. Next slide. The plans displayed here on this slide are the silver and gold plans offered by Anthem. Like the prior slide, some of the changes for 2019 will result in designs that are quite different from the plan offered for 2019. Next slide. The plans displayed here are offered through Connecticut Benefits, Inc., CBI. There will be only one plan terminating at the silver level, with enrollees of that plan being mapped to a renewing plan. One item to note here is that while the 2018 Choice Silver Alternative Plan is renewing, there again are significant changes in the plan's cost sharing for 2019. And coming up in the next section of this presentation, we'll review some of those high-level changes for a number of the plan offerings, including this specific plan. Next slide. And Ann will be taking over.
Thank you, Ellen. For this upcoming section of the presentation, we have 22 slides of the various plans that will be offered through Access Health CT for the 2019 plan year. This includes silver cost sharing reduction plans that are available for silver plan enrollees with household incomes ranging from 138% to 250% of the federal poverty level. We have not included information on the two catastrophic plans offered from Anthem and CBI, simply because those plan designs are so specified by federal government requirements. We are not going to be reviewing each one of the 22 slides, but this presentation, like Ellen mentioned earlier, will be made available to you in the near future so that you can refer to information on a specific plan. The slides are set up to show in-network cost sharing for certain components of each plan, including deductible and maximum out-of-pocket for a single enrollee, PCP and specialist visit, inpatient hospital, and 1 month supply at a retail pharmacy for prescription drugs. The detailed plan document for each plan is available on the Access Health CT shopping portal. These documents contain information on the cost sharing for many other services covered under the plan, as well as plan exclusions and limitations. Next slide, please. This is an example of a plan which resulted in minimal cost sharing changes for 2019. It represents the standardized gold plan offered by each carrier. Plan names are listed above the table with the benefit detail. For this plan, the cost sharing changes resulted from the need to come into compliance with the actuarial value of a gold plan for 2019. Within the exhibits in this section, we've attempted to highlight changes that would likely be considered to have a negative impact on a consumer with red shading and font. So, because the in-network individual medical deductible has increased by $50 and the in-network individual maximum out-of-pocket has increased by $600 for 2019, the consumer could potentially see an increase in the amount of financial responsibility in terms of cost sharing under this plan. Note that there was no change in the separate prescription drug deductible for this plan for 2019. Next slide. This slide shows high-level benefits for the Access Health CT standardized silver plan offered by both carriers. Similar to the previous slide for the standardized gold plan, the cost sharing changes to the individual deductible and individual maximum out-of-pocket were necessary so this plan could continue to be compliant with the actuarial value guidance for a silver plan in 2019. Next slide. This slide here represents a new plan that is available for 2019. Access Health CT's Board of Directors voted to add a new standardized silver plan for 2019 that is primarily coinsurance based. In order to participate with Access Health CT, carriers are required to offer this plan. Compared to the plan on the prior slide, the premium for an unsubsidized enrollee for this plan would be about 6% less from Anthem's standard silver to the Anthem Silver Coinsurance Plan, or about 15% less from CBI's standard silver to the CBI Silver Coinsurance Plan. Next slide. This slide represents the standardized bronze plan required by Access Health CT. There were minimal changes to this plan, basically the maximum out-of-pocket only, again, to get the plan into compliance with 2019 actuarial value requirements. Next. This next slide shows the bronze HSA plan that is required by Access Health CT, again, a standardized plan. And there were no changes to the high-level cost sharing for this plan for 2019. Next. The CBI Choice Silver Alternative Point of Service Plan has renewed for 2019, as Ellen mentioned earlier, but there were some fairly significant changes in the plan cost sharing as part of the rate and form filing process through the Connecticut Insurance Department. Some of these may be perceived as favorable to an enrollee, while others may not. Taking a look at the components shaded in red with red font, you'll see the potential for enrollees to have to pay much more out of pocket in the plan deductible, going from $1,750 to $4,500. And for a specialist visit, the service is now subject to the plan deductible compared to 2018. For the areas shaded in yellow, there may be both increases and decreases in the actual cost sharing value. So for an example, an inpatient stay is 40% after the deductible for 2019, which one might think is an improvement compared to 50% after deductible in 2018. However, because of the plan deductible increase, this is likely to result in increased financial responsibility for an enrollee. We'll be spending only a moment on a few more of the subsequent plan comparisons on cost sharing and scrolling through most rather quickly now that we've had a chance to review several of them. The CBI Passage Bronze Alternative PCP Point of Service Plan, we are going to just scroll through that. And now I'm going to turn the next few slides over to my colleague, Ellen Kelleher, to review.
Thank you, Ann. For this particular slide, it represents high-level cost sharing for the new Anthem Tiered Gold plan. Essentially, this plan is structured such that an enrollee can obtain services from specific primary care physicians or providers, PCPs, specialists, and hospitals, as well as some other services that results in lower out-of-pocket costs when compared to other providers. As an example, for Tier 1 PCPs, an enrollee would pay $20, not subject to the plan deductible, per visit, versus 30% after the plan deductible for a Tier 2 PCP. A consumer will want to be aware of which providers are considered Tier 1 versus Tier 2. This information is included in the carrier's online provider directory tool, which is available as a link from the Access Health CT shopping portal. And as mentioned previously, the detailed plan document for each plan is available on the Access Health CT shopping portal. These documents contain the information on the cost sharing for many other services, in addition to those shown here, as well as plan exclusions and limitations. Next slide, please. The high-level plan design change is new for 2019 non-standard plan. This is yet another new plan offering from Anthem, although this is a silver medal level and is a PPO. You'll notice that this plan not only differentiates cost sharing for PCP, specialist, and inpatient hospital by Tier 1 versus Tier 2 providers, it also differentiates this for the plan deductible. And again, as mentioned, once you're in the Access Health CT shopping portal, you will be able to directly click in these particular fields to bring up the actual detailed plan document that will provide the different cost share levels for these particular in-network levels. Next slide, please. This is the last of the new tiered plan offerings from Anthem. This is another HMO plan, although it's at the bronze level. And again, once again, you will see there are Tier 1 providers and Tier 2 providers. This will all be available at a much more detailed level, both in the provider directory tool and in the actual plan documents that we also provide on our Access Health CT shopping consumer portal. Next slide, please. And please note that the remaining slides, including this one in this section, will pertain to the cost sharing for the silver cost sharing reduction plans, also known as CSRs. We'll continue to scroll through most of these rather quickly, as we've mentioned before. But again, you will have these at your fingertips when we provide them with all the detail necessary. In this particular slide, a household with income ranging from 201% to 250% of the federal poverty level is eligible to enroll in a 73% cost sharing reduction plan level. Next slide, please. And here you will see at the 87% silver CSR level, a household with income ranging from 151% to 200% of the federal poverty level is eligible to enroll in this 87% CSR plan. Next slide. And lastly, again, for the silver plans, a household with income ranging from 138% to 150% of the federal poverty level is eligible to enroll in this 94% CSR plan. Next slide, please. And again, you will see here we have additional, this is yet another slide that shows the Anthem Silver PPO standard and CBI standard silver co-insurance based plans. Again, this is a new plan for 2019. This you will see is the 73% level. And we can scroll to the next. This is the 87% CSR level. And you can scroll through to the next. And the 94% CSR level. Again, these are the new standard co-insurance plans that both Anthem and CBI are required to offer. And then the next slide, please. This is the CBI Choice Silver Alternative POS plan. This is, as you know, a non-standard plan, so it has somewhat of unique features that CBI has incorporated. And what you will see here is a difference between the 2018 cost sharing that exists today versus the 2019. And as Anne has mentioned in her slides previously, anything denoted in red are the changes that are somewhat significant and that could will impact existing members. And then those that are also noted in yellow could have a plus or minus, a positive or somewhat disruptive perspective. And those are just simply noted in red as well. And then the next slide. Okay. And again, this is a renewing slide. This is the some more information that while on this cost choice silver alternative POS plan at the standard level, meaning for an unsubsidized person or one who is eligible to receive PTCs only, as well as the 73% CSR version, had more significant plan changes than this one at the 87 CSR percent level. On the next slide, at the 94% level, again, similar to the 87% CSR version of this plan, there are not quite as many significant cost sharing increases as at the standard or the 70% level and the 73% CSR levels. On these next slides, we will probably be scrolling through. Again, there are no significant changes. So on the next 73%, as you see here, the 87, and then the 94%. And again, rest assured, all of this information will be made available to you so that you can have this as reference material. And with that, I will turn that over to Anne to talk about comparative analysis on both on and off exchange.
Okay, thank you. We can actually advance to the next slide, please. Nope. One back. There we go. We wanted to take a minute or two to talk about plans that were filed with the Connecticut Insurance Department that would be offered only off exchange and compare them to the on-exchange plans in terms of the sequence in premium rates for unsubsidized enrollees. There were a total of 31 plans approved for 2019 for the individual market. Carriers may not actively market all of the approved off-exchange plans. The key on the right-hand side of this slide is intended to guide you on the entries in the large table. Anything in bold font represents a plan offered through Access Health CT. The color scheme of blue, orange, gray, and yellow correspond to the plan metal levels of catastrophic, bronze, silver, and gold, respectively. And for each county, in ascending order by premium rate, you'll see which plans offered by which carriers by which metal level. On the next slide, we're not going to spend any time looking at the next slide. I'm just basically going to present the information to you because I'd like you to continue to view this slide as I talk through what this actually means. So we're just going to stay on this slide here. So at the bronze level in every county, all 6 bronze plans offered through Access Health CT are lower in premium than any of the 5 bronze plans that were filed as off exchange only. For silver, in all counties, there are at least 3 silver plans offered through Access Health CT that are lower in premium than all 6 silver plans filed as off exchange only. In all counties, there is at least 1 silver plan offered through Access Health CT that is lower in premium than some bronze plans. And again, this is a mixture of both on and off exchange plan information. For gold, in every county, there is at least 1 gold plan offered through Access Health CT that is lower in premium than any of the gold plans filed as off exchange only. 1 gold plan offered through Access Health CT in 6 counties is lower in premium than some silver plans in those same counties. Next, this is the slide, if we can take a quick pause, this is the slide I pretty much just presented the information to you while we were looking at the chart that might be a little bit more difficult to follow. So next, premium tax credits. We're going to just take a brief moment to talk about premium tax credits, or we call them PTCs, often referred to as APTCs, because some enrollees elect to get them in advance. These can be used by consumers with income from 138% to 400% of the federal poverty level to reduce the premium cost of a qualified health plan obtained through Access Health CT in the individual market. Next. This slide outlines the key components that are taken into account in calculating the premium tax credit. You've got the household income, ages, and geographic location, and those are used as follows. Income relative to the federal poverty level is used to determine whether an individual would qualify for a premium tax credit. Ages are used to determine the cost of the benchmark plan for the enrollees within the household. The cost of plans can vary among the 8 counties or rating areas in Connecticut, so residence location is also a factor. The benchmark plan, also known as the second lowest cost silver plan within a county, is used in determining the maximum amount of tax credits an enrollee could be eligible for. And the required contribution, also known as the expected annual contribution, is the portion of income that the household is responsible for paying towards the cost of a qualified health plan, and is based off the income level compared to the federal poverty level using a factor set by federal regulations. Next slide, please. This slide shows for 2018 and 2019 which plan by county was considered to be the second lowest cost silver plan or benchmark plan. And on the last column of the table, the percent change in the rates of the benchmark plan was a decrease in every county compared to 2018. Also, none of the 2018 benchmark plans will be renewing for 2019. This is an indicator that the premium subsidy amount for 2019 will be less than it was for 2018. Next slide, please. I'm not going to be spending any time at all on this next slide. We just wanted you to have the math available to kind of go back to in the event that anyone was eager to do a premium tax credit calculation or to validate the numbers that we have on the next couple of pages. In the renewal scenarios that we're going to review next, you're going to see how the monthly premium tax credit for 2018, shown in this chart as $343.20, and for 2019, $266.41 is applied to the different plans available at the silver and bronze medal levels. Next. As we go through these next scenarios, it's just important to note that different households, even those with the same number of members as the scenarios that we're going to show you here, will yield different results because of differences in income levels, county of resident, and selected plan for 2018. And we just want to and make sure that you're not assuming that the amounts of the net costs after premium tax credit is applied will be similar for all other family situations. Each household could be unique. Next. In looking at this example for Michael, who is a single enrollee who was 43 years old at the start of the 2018 plan year, turning 44 prior to the 2019 plan year, we see he was enrolled in the Choice Silver Standard POS plan for 2018. That was the lowest cost plan in Fairfield County in 2018, the lowest cost silver plan, excuse me. The monthly premium for that plan was about $631 per month, and based on his income at 300% of the federal poverty level, his net monthly premium after financial help was about $288. Per federal regulations regarding annual redetermination, an enrollee's coverage will be renewed in the same plan as the current qualified health plan, unless that plan is no longer available through the exchange. The column that's titled 2019 Auto Renewed demonstrates the resulting changes of this, which includes the age differential for Michael turning 1 year older for 2019. As you can see in the table, the premium goes up to $682, an 8% increase over 2018. This is comprised of the plan's rate increase of 4.9% for 2019, plus the approximate 3% increase for the age. The tax credit decreased compared to 2018 as a result of a number of factors, including new lower cost silver plan options, resulting in a reduction of the benchmark plan by 13% for Fairfield County and adjusted for age, slight increase in income, but basically maintaining 300% of the federal poverty level. That was about 0.5%. And adjustments in the required contribution percentage specified in IRS guidance, resulting in approximately plus 3% more as a portion of income that an individual would be required to put towards the cost of the QHP. The net result is the maximum premium tax credit that's decreased by nearly $77 for 2019 to roughly $266, or a little over minus 22%. The change in the net premium goes from approximately $288 to $415 for 2019, an increase of approximately $127, or about 44%. Now, this slide also shows that there are a number of silver plan options that are less costly. We talked earlier in the presentation that there will be 6 silver plans offered between the two carriers that are available through Access Health CT for 2019. So the plans that are in the 1, 2, 3, 4, the last 5 columns of this chart show the options that are less costly from a premium perspective than the auto renewed plan, ranging from about 3% less to about 21% less. We are showing each of the plan alternatives as I mentioned here, and the last plan option shows that the enrollee's net premium after max premium tax credits are applied could result in a lower net premium compared to 2018, $269 versus $288, or about minus $19. However, an enrollee has to consider the differences in plan design to ensure that this new plan would meet his health needs before switching. So we can go to the next slide. We've already talked about the changes in plan cost sharing for many of the 2019 plans, but we didn't compare the 2019 plans side by side. So this exhibit is intended to do that for the two plans that we just talked about at the silver medal level, the renewing plan for 19 and the lowest net premium cost silver plan. So we're not really going to talk through these differences due to time constraints, but you'll be able to see them, as Ellen mentioned, when you get this, when you get the deck. And again, other elements of cost sharing may be of concern to a particular enrollee. And these are just the very, very high level. If we can go to the next scenario, this is a renewal scenario for the bronze plan. And I'm not going to go through all of the numbers as much as I would like to have to do that. But the major point about this particular slide is that for the bronze plans, many of the bronze plans actually received a higher increase relative to the plans at the silver medal level. So the differential between the bronze plans and the silver plans is collapsed a little bit. Consequently, for Michael, again, that same person that we talked about in the previous scenario, let's just pretend he's elected the bronze plan, the lowest cost bronze plan in 2018. The lowest possible bronze plan for Michael at the same federal at the same income level relative to the FPL, with the subsidy of $266.41 for 2019, will result in Michael not being able to get a plan that's less costly than he paid in 2018. And in fact, the best option for him in Fairfield County would be a $77 increase compared to what he was paying in 2018. But if you want to look at it on the other side, basically instead of him paying an increase of $179.83, this does go down to an increase of $133, or approximately $46 less. And on the next slide, again, similarly to what we talked about before, just a comparison of the plan designs, that the enrolled plan design for 2018 versus the Passage Bronze plan that he can choose, which would be his lowest cost alternative for 2019. And as Ellen mentioned before, the Passage plan requires selection of a PCP upon enrollment. So I'm going to spend another minute or so, if we can go to the next slide, just very quickly reviewing the dental plans. Standalone dental plans, SADPs. You can go to the next slide. This chart here just represents the 3 different standalone dental plans available through Access Health CT for 2019, all through Anthem. There have been no changes in any of the cost sharing that Anthem submitted last year versus this year. Each of these plans is compliant with federal regulations to be offered as a standalone dental plan on exchange, because they include the in-network out-of-pocket maximum of $350 for one child and $700 for 2 or more children in a family. They include the required essential health benefits for a dental plan in Connecticut for the pediatric portion of the plan. And they don't include any plan maximums for children under age 19. One item just to kind of note in the last column there, the Anthem Dental Family Value Plan, it does not include coverage for adults for major services. And if we can go to the last slide here. This plan just gives you an idea of what the monthly premium would be for standalone dental for those 3 plans. And for 2019, there was no change in the Anthem Dental Family Enhanced Plan premium rates for either children under age 19 or adults 19 and over. For the Anthem Dental Family and the Anthem Dental Family Value Plan, again, no change in the child rate for 2019 relative to 18, but there was about a 10% decrease for adults age 19 for both of those 2 plans. And that's all I have. And again, I got off to a little bit of a late start, so we didn't have as much time for questions as we would have liked, but.
Terrific, thank you, thank you. We actually, we could accommodate about 10 minutes worth of questions. And before that, though, I want to make a quick announcement, and that's that the Access Health Connecticut comparison tool is available starting today. So for all of our consumers and your clients, make sure that they look for the icon at the accesshealthct.com website. With that, I will open the floor to some questions. Yes, Gary?
Just want to say that early shopping is open now too.
Yes, and early shopping is open now too. Thank you. Terrific. If you have a question that you can type in to the chat box for us, we will have our panelists consider it and give us an answer. So if I can see.
So Scott Nelson has a question.
Okay. The preferred way to communicate the questions will be with the chat box. So I have one here that says, what happened to the consumer decision support tool? And this is what we just announced. It's available today. So that's the good news. Do you have any other questions? I'm sorry, yes. There's a second part to this, and I'll have Shelley share that for us.
So you can use the comparison tool on our website. We understand that there's a part missing where you could identify members that are not applying for coverage. That was removed from this year's plan, this year's tool. However, on the broker support website or broker webpage, we are uploading a workbook that will be available to you that you can download and use just as the old tool, where you can put in how many members are applying and factor in those who do not want coverage. So it's going to be a useful tool for you and available on our website.
Wonderful, thank you, thank you. And that was Shelley from Access Health Connecticut as well. The question is CB Connecticut.
Yeah.
CBI, I'm sorry.
Yes.
That's correct then. Great. I'm looking for any other questions. Is the workbook like a website or a worksheet? The workbook that we just announced? Yeah, it will be an Excel worksheet. Oh, someone is asking for clarification on what early shopping means.
You can go on the portal now and take a look at the plans that are available for 2019. You cannot purchase a plan, but you can see what is available. You can look at the costs, the co-pays, the plan designs, and do your comparison tool, and then make your decision so that when it comes time for open enrollment, November 1st through December 15th, you will be all set to go with your clients.
Terrific. Thank you. Thank you. Appreciate that answer. I'm looking for any other questions that we may be able to fit in with this time frame. Why can't we see all our clients as a roster? Does that make sense?
Understand the question.
Yeah.
So those of you who have access to your broker portal, when you look under your client lists, you can see up to 250 of your active Tangled clients. This may not include past clients that you had before, or if they've moved on to another broker, or may have just moved on to other coverage. So be sure that the list that you're reviewing, you understand that it's only your Tangled and active clients. If you have any questions regarding your particular client list, please email the broker support inbox directly.
Great. Thank you. Thank you so much, Shelley. Let's see. There are quite a few. I'm trying to fit in as many as I can. People who enroll during SEP will be auto-renewed. Will we get paid on the renewal? There's a question on commissions here.
You will not get paid for SEP renewal. The advice would be that we're encouraging all our customers to shop. So if you have a client that you worked with before, use this opportunity to use our comparison tool, look at our plans for 2019 before open enrollment. There may be a better option for them. And that way you can enroll them into the best plan for their situation.
Okay, thank you. Thanks again. All right, what is the broker support inbox email? Want to make sure it hasn't changed. Yeah. All right, we will get you an answer to that question in just a moment so that we can give you the accurate answer. And while we do that, okay, Shelley, you have the broker support inbox email?
Correct. It is AHCT Broker Support at ct.gov.
Again, AHCT Broker Support at ct.gov. Terrific. Thank you. All right, we are also posting some of these answers on the chat box so that you can have it reviewed. And let me once again remind everyone that this presentation will be made available both online as well as with the slides shortly after today's webinar. And I'm going to have an opportunity for perhaps fitting one more question. And I'm looking at the chat box to see, here's the last question that we'll consider. If the client is moved to a similar plan because his 2018 plan was terminated, are we remaining the broker of record?
Yes, as long as you're tangled, you will be the broker on record.
Okay, terrific. So you will be the broker on record. Excellent. All right, with that, I'm very conscious of everybody's time. I want to make sure that I give a very special thank you to today's panelists, Gary Dorsey, who is the Director of Product Development, Ann Lopes, who's a Carrier Product Manager, as well as Alan Kelleher, another one of our Carrier Product Managers. And we especially thank you for taking the time to be a participant at today's webinar. With that, look for more announcements. We would like, as Gary mentioned at the beginning, to hold monthly webinars to give you the information that you need in doing the role that you play so importantly with Access Health Connecticut. So with that, we will close today's webinar. Thanks again. Have a wonderful rest of your day.